Hi there, I'm Dr. Sean Moore. I'm an emergency physician and transport medicine physician working for 30 years in rural Canada. And today we're going to be talking about pelvic fractures and specifically pelvic binding. In my many years of working in emergency medicine, I found that pelvic injuries are the most overlooked and often serious or deadly injuries in the traumatic setting. If a pelvic injury is suspected, or there is a high-energy mechanism of injury in an unconscious patient, the pelvis should be bound with a commercially available device. Never do this. You can reliably suspect that about 500 cc's to a liter of blood will be lost into the pelvis if you apply that kind of pressure. There are several devices available, and today I'll demonstrate the T-Pod as it is commonly available, relatively cheap, and easily performed. To properly apply a T-Pod pelvic binder, 1. Remove the clothing. Ensure the patient's clothing is removed, especially around the hips and thigh regions, and allow for direct contact between the skin and the T-Pod belt. 2. Position the belt. Place the T-Pod under the patient's pelvis, aligning the center of the belt with the greater trochanters. 3. Trim or fold. Depending on the specific T-Pod model, you might need to cut the belt or fold it back, leaving a gap, typically 15 to 20 centimeters or 6 to 8 inches over the pubic symphysis. 4. Apply tension straps. Attach the tension straps, which are Velcro, to the belt and pull the straps to create circumferential compression. 5. Secure the belts and straps to ensure consistent pressure without accidental release. 6. Record. Document the time, date, and patient's electronic patient number on the T-Pod directly. 7. Monitor or adjust. Check the binder regularly for proper placement and ensure it is not too tight or too loose. Binding the pelvis reduces overall pelvic volume and creates a tamponade effect, stabilizing the fracture fragments, reducing hemorrhage, and improves hemostasis and patient comfort. Pelvic binders should not be used for isolated hip or femur fractures. Major mechanisms of injury suggestive of pelvic fracture include any of the following: hemodynamically unstable patients following trauma with a heart rate over 100 or a systolic blood pressure less than 90 at any time during their post-injury resuscitation, pelvic pain on an exam, pelvic instability, and a decreased level of consciousness. In my years of working in emergency medicine, this is the most frequently missed deadly injuries among trauma patients. Treating pelvic fractures is simple and quick and can get patients temporized until they can go to a tertiary lead trauma center.